Hi, and thanks for tuning in. I'm Dr. Sharif Moore of the Drug Free America Foundation, and this is the Pathways to Prevention podcast, where we discuss some of the most innovative and inspiring work being done around the world in substance use prevention, treatment, and recovery. Joining us today is the Secretary General for the World Federation Against Drugs, Regina Mattsson. Thank you, Regina, for joining us.
Thank you for having me. It's an honor.
So before we get started in talking more about what WFAD does, can you just share a little bit about your own personal journey and how you came to work in drug demand reduction?
Sure. I come from a family that's always been very socially engaged. My mom has, since she was young, worked within the field of addiction in different ways, offering social integration, reintegration services for people who have been in jail or people that have, for different circumstances, been quite far away from the labor market, the regular labor market. So growing up, this is quite an integrated part of my life and something we spoke about quite a lot in the home. And I know when and I guess I'm moving forward a bit too much now, but when I was employed in WFAD, my then boss, Linda Nilsson, said something along the lines that I was raised in the recovery school, because she was well aware of the organization that my mother had been involved with for the past 15 years prior to that. But I started my social work bachelor degree thinking I wanted to work within the area of people who are living in homelessness. And as we're all very aware, these, addiction and homelessness are quite interlinked oftentimes, and especially here in Sweden. So I started off that journey, and I finished, and I was employed to work in 2014, 2015, where a lot of migrants and refugees came to Europe. I was employed at something called the Arrival Unit for Unaccompanied Minors. So I worked with the first initial steps when a young person came and sought asylum here in Gothenburg and in the neighboring cities, to provide safe housing and see if there were any need for treatment or trauma-informed counseling, for instance, and to ensure that they had some place to stay when they arrived here, be it in foster home care or within the housing that was provided by the city. So I started off there, but then as social work is very much defined by the political decisions made, after some political decisions were made to stop focusing on this specific group, and they closed the borders here in Sweden, this unit that I worked with was dissolved. And so I began working instead with another, sort of step in the trajectory of seeking asylum. So I started working with families and individuals who had received asylum and were beginning their process into integration. So learning Swedish, vocational training, job opportunities, for instance, and social welfare benefits. So I was doing that, and I was just getting more and more angry at the fact that we focus a lot on how we say this in Swedish, but we focus a lot of, putting out fires rather than preventing certain aspects of happening. And the reasons for this group that I was meeting, for the disparities that they were seeing in starting off their lives in Sweden, those reasons had happened long before. It took at that time about a year or 2 years before you received asylum after moving here or coming here to Sweden. And during that time, people weren't offered, vocational training or learning Swedish. So once you received asylum, you had a very short time to learn everything, and it was very difficult to know where to go. And if you had declined an offer of housing earlier in the process, perhaps you had family members you could stay with, for instance, our hands were tied. So I was becoming more and more angry and not being able to provide the support that our clients were, that it was their right. So I started looking more to the structures, because I have always believed, but I do think that a lot of our social problems are directly consequences of the social structures in place. And I wanted to work to change those structures to create a better environment for all people, and especially people who are particularly vulnerable. So then I started my master's studies with this in mind and wanting to do actual change for people in a sustainable way. Although I loved working with people directly and offering that kind of service, I wanted to work more towards the structures. And I was lucky enough to be contacted by WFAD. They needed somebody to work 20% for our World Forum. So I came for an interview and we talked a lot. We talked about the experiences also of the group that I had met, because part of this was, of course, referrals, because a lot of the group, or not a lot, but some of the people that I had met had also needed treatment services and recovery services. So I was lucky to get the job. And since then, there's no turning back. I've been honored and happy to learn more. And seeing this organization grow as it has, I'm just happy to have been a part of it. And so it was a bit of in Linda's words, being raised in the recovery school, perhaps this was the direction I was always going, although I wasn't aware of the fact. But that's sort of how I happened to come into the world of WFAD.
Sounds like everything just fell into place.
Yeah.
So a lot of our listeners probably aren't familiar with WFAD, World Federation Against Drugs. Can you just talk a little bit about what the organization is and the kind of work they do and where they do the work that they do?
Of course. So the World Federation Against Drugs, WFAD, is a multilateral community or an umbrella organization with member organizations and individual members from across the globe. As of now, we have 340 member organizations in 60 countries and about 400 individual members in the same amount of countries. And we work with strengthening prevention, increasing access to treatment, and in promoting recovery. And as of our latest General Assembly, we've adopted a 10-year strategic plan to focus particularly on the needs and the rights of women and children within our field. And this is something that we implement not only through our work within advocacy towards the United Nations, European Union, African Union, but also towards working with our members to ensuring that all of our members receive capacity strengthening within these areas, and how to integrate a gender-sensitive approach, how to integrate the rights and the needs of children and the Convention on the Rights of the Child within our services and activities, but also within the structures of our organizations. So that's the work we do on one level, so to speak, the advocacy part of the work. The other hand is working directly with members, and we do this through providing regional and world forums, usually on topics, and particularly in terms of regional forums, we will do that on topics that are important towards that region. So, for instance, we had a East African regional forum right before the pandemic hit in February 2020. And there we focused a lot on youth and prevention among youth and within the particular countries of the East African region as well. And we also have projects together with our members. We have quite a lot of really fantastic projects, and these are rights-based. So it's not something that we from the Secretariat come in and say, let's do this project, but it's usually our members that come to us with a project idea, and then we further develop it and apply for that funding together, and then we work together on these projects. So one and our most long how do I say this long going project, it started in 2015, is the Choose Recovery project, and this is a project in the Western Balkans in 3 countries that we do with our members that focuses on offering support to people in their recovery journeys. So there is a telephone hotline that is available in the 3 countries that anyone can call if you yourself are using drugs and want support in finding treatment possibilities, counseling, recovery possibilities, or support in your recovery journey. And there are also counseling centers in each of the countries. So that's the project that we have that focuses particularly on recovery and does so through not only working directly with people, but also research on stigma and trying to and working very well to engage the key stakeholders in these countries with the drug offices and also municipal and city-based units that work within the issues of drug policy and prevention, treatment, and recovery interventions and programs. So it's a fantastic project. It's seen very good results, and we've seen also over the course of the years that more and more women are being involved now in the project as well. So there's an activity focusing on photo voicing, where this is aimed to support in the recovery journey through an artistic art therapy approach. And in light of this, with the art therapy approach, we have recently also conducted a pre-study in another country called Georgia in Europe that focuses on art therapy as well for young people. We have a lot of good projects. I mean, you're most welcome to look on our website, but just to mention another one, which is our largest project at the moment, is called Sober Youth, Healthier Communities, and it's located in Kinshasa in the Democratic Republic of Congo, where we, together with our country office and 3 local organizations, work to support young people in their process of leading violent street groups called kulunas. And these street groups are oftentimes organized by ensuring that young people, children, adolescents are involved in violent behavior, criminal activities, and where drug and alcohol use is quite interlinked and intertwined with the process of just being involved in these groups. And so there we focus on the whole, we try to have a holistic approach. We focus on psychosocial support and trauma-informed support, especially for the young girls who have been involved in the group, in the kulunas. We focus on vocational training, and then we have income-generating activities as well, where the young people can first go through the psychosocial support, the vocational training, and then are offered jobs within the program of income-generating activities. And these are focused on waste management and water production. So we try to involve the communities and, of course, the parents, because a lot of these young boys and girls who are involved in these gangs, they're still living with their families. But there is a lot of stigma concerning this, not only from the families, but also from the community at large. So having these young people engaged in these income generating activities that are also showing a sustainable environmental aspect within the local communities have shown as well a lessened stigma in the group that support their reintegration into those communities and into society at large. So it's been absolutely fantastic so far. We've just finalized our first year. And just to mention, one outcome is that in 3 parts of the very large city of Kinshasa, they have seen now running water for the first time in 10 years. So we're seeing these very noticeable outcomes, whilst also seeing these young people thriving and feeling empowered and regaining self-esteem and leaving these violent street groups. And we can also see in the activities that are happening that a lot of new young people are coming and contacting our colleagues on the ground and asking how they can be part of the program and wanting to get involved in different ways. So it's been an absolutely extraordinary year for this project, and we're happy to see it going on for at least 3 more years, and hopefully for a more longer period of time as well after that. But that's just a little bit of the work that we do. And I should mention as well that as part of our overall strategic focus to focus on women's rights and needs and children's rights and needs within our field, we have a gender working group with participants from 10 different countries that are working together with us to ensure that we keep a gender approach within our activities, and we're offering certain webinars and capacity strengthening trainings and publications on these specific issues as well.
Wow, what a fascinating project. Have you had the opportunity to visit your field site in Congo?
Yes, I was very lucky and fortunate to be able to go. We went for like a pre-study visit in February, also in February 2020, beginning of March. And we were there for a week. We visited with the Swedish Embassy, who are the funders of the project, through a Swedish development cooperation agency named SIDA. That goes through the Swedish Embassy. So we met with the embassy and we met with all our project partners and had study visits to the field of the work that they're already doing there. So I was very fortunate to have been able to go, and we're looking to hopefully, fingers crossed, go again in the beginning of the new year as well.
Very cool. I always thought that would be a very cool place to visit. And it's so, the clothing is so colorful, the culture. Yeah.
Yeah. Yes, I felt very boring in my outfits, being from Sweden, only wearing black and white, coming to this beautiful, colorful place where everybody's not only, colorful in their dressing, but in their personalities. I mean, we were met with so much kindness and knowledge. I mean, it was absolutely incredible to meet with our project partners, as well as we met with some of the ministers and the embassy officials as well. It was just absolutely fantastic.
Wow, so that's very impressive. WFAD really is very active in a lot of different places doing some really great work. Now, can you talk a little bit about how women are uniquely impacted by substance use, and especially stigma surrounding substance use?
Certainly. We can say that although overall drug use remains relatively low among women, still, men being 3 times more likely than women to use cannabis, cocaine, or amphetamines, women are still more likely than men to misuse prescription drugs, for instance, particularly opioids and tranquilizers. But the impact of drug and substance use on women differs, of course, from country to country. Overall, it can be said that women who are struggling with addiction are more likely than men to have experienced childhood adversity, violence, gender-based or intimate partner violence, and even having initiated drug use due to a intimate partner or a family member that themselves are using drugs. So that's one of the differences in the initiation of drug use. But then we can see as well that men generally have more externalizing behavioral problems, so to speak, whereas women tend to have internalizing symptoms such as depression or anxiety. And although women typically begin using substances later in life than men, upon initiation, women tend to increase the rate of consumption more rapidly than men. This is something called telescoping. And this is also seen where we have treatment possibilities and see that women enter into treatment. They're usually further on in their trajectory, because one of the things that we've seen, for instance, here in Sweden, but also in other countries, of course, is that women tend to hide their substance use better, and even due to norms in society and expectations of women and girls. Police, for instance, or treatment providers tend not to see that girls or women are using drugs until it becomes much further on into the trajectory. But although women use drugs differently and respond to drugs differently, they do have unique obstacles in accessing treatment. And I mean, not only treatment, but also prevention. We can see that although 1 in 5 drug users is a woman, women account for very few people in treatment, and even less in certain parts of the world. And we can see that the availability of services remain limited on a global level. And although we have certain numbers to see, that only 1 in 8 people who need treatment are accepted into treatment facilities. But these numbers still mask very terrible regional differences and say nothing really about the quality of treatment, because what we can see is that stigma, for instance, is one of the main barriers in accessing treatment for women. Um, on an individual level, we usually say that, you know, people who use drugs um, are affected by stigmatization, whereas women, I mean, for women, we call it double stigmatization. So not only due to the use of drugs in particular or per se, but also due to these normative gendered roles, such as the caregiver role, for instance. And this stigma can also be seen as barriers in accessing treatment. On one hand, from fear of seeking support, fear of losing your children, fear of being stigmatized by the service provider, but also due to obstacles such as lack of childcare services, for instance. Perhaps there is nobody around the woman who can take care of her children when she enters treatment, and treatment facilities do not tend to offer residential services for women and their children. So this becomes a big obstacle as well. But even when you enter into treatment as a woman, a lack of gender sensitive and trauma informed interventions and expertise can also cause the women to not undergo the full treatment services. We can see that women in general are more responsive to treatment, but it needs to be gender sensitive and trauma informed for that to happen. And we're talking about it, or I'm talking about it in very general terms now, but we can also see that in certain parts of the world, in some of our member countries where our member organizations work, there is little to no possibilities for women to enter treatment. They may only have unisex facilities, or not at all, not any, you know, women specific or women friendly treatment facility, which also becomes a huge barrier, of course. I did read the World Drug Report that there was in 2018, there was a World Drug Report publication that was focused particularly on women and drugs. And I saw something that I thought was very interesting here, and that is that the existing research that was highlighted in the World Drug Report points to unequal opportunities that are influenced by social and cultural norms as well, but in accessing illicit drugs as one of the reasons in the differences in prevalence of drug use between women and men. So according to this highlighted study in the World Drug Report, they say that if access to drugs by women and men were equal, the likelihood of substance use would not differ. So it's a lot of different levels. I thought this was very interesting, that this was one of the key aspects that they talked about as a reason for this historical gender gap that we can see in drug use among women and men. And unfortunately, something that is also highlighted is this historical gender gap that, you know, 1 in 5 drug users is a woman. This is narrowing in certain parts of the world among the young population, and particularly in the Western world.
So, in other words, well, what the report is saying, if women had the same accessibility to drugs that men have, that disparity in use would still exist.
Yes, I mean, according to the report, they would say, or actually the opposite. If women had the same access to drugs, the percentage of usage would be the same. So that's what I found interesting, because we can still see that there is a gender gap in use of drugs, and we can see that there are differences in which drugs are used and why they're used. For instance, the reasons as highlighted in studies for why women begin to use drugs can be things such as chronic pain. Women are more likely to be prescribed opioids for chronic pain, for instance. Mental illness, such as post-traumatic stress, depression, eating disorders, or anxiety can be initiators of drug use, but also trauma. So domestic violence and abuse, sexual abuse, for instance, are higher among the rates of these types of violence are higher among women who use drugs than women who do not use drugs.
Yeah, I recently developed a workshop on opioids for a local conference here in the United States. And when I was looking at the epidemiology, of opioid use, and especially injection drug use, injection opioid use, I was really shocked to find that 73% of injection drug use among women in the United States can be explained by sexual trauma, usually, rooted in childhood. So
It's such alarming figures, and it's something that is quite evident globally as well. There are studies that show that women who use drugs have a 2 to 5 times higher prevalence of gender-based violence than the general population of women who do not use drugs. And the difference here, because gender-based violence and sexual abuse towards women globally, 1 in 3 women have experienced sexual or physical abuse in their lifetime. 1 of 3 women over 15 globally, and I mean, this does not entail economic abuse or material abuse or digital violence or the more emotional abuse, but only sexual and physical. And for women who use drugs, these rates are even higher. And unfortunately, which is one of the main one of the things that it's important to highlight here, is that within the realm of gender-based violence, it's usually an intimate partner or a previous intimate partner that would subject you to violence. But for women who use drugs, this could be done by, authority personnel, somebody that you don't know that you've met. It can be treatment professionals. It's a much more wider spread of people that are subjecting women to violence, and it becomes, as the result of this is that there aren't really any safe spaces for women who use drugs that are experiencing violence. And it's also interesting to see what comes first. We do know that for women who use drugs, childhood adversity or sexual abuse in early years or in young adulthood have great effects on the initiation of drug use or alcohol use, but also having, on one hand, then having experienced violence in some sort may render you more prone to initiating drug use, but also having initiated drug use, women who use drugs are more susceptible to violence because of this, unsafe spaces, not only within the relationship, but also within these areas in which you maybe seek support, or, authorities, police, treatment officials, etc. So, and it's important as well, because it's very difficult to talk about women who use drugs and gender-based violence as 2 separate arenas. I mean, it's important for all of us to always talk about gender-based violence and to strive to work to eliminate this, because it's not inevitable. It's not something that must happen, but it's something that we can actively work against as a society. And it's important then for us all to bear in mind that when women are accessing treatment or, counseling or even prevention activities, that we do have this in mind, that we keep a trauma-informed approach and a gender-sensitive approach, because these are key issues that need to be addressed as well. If a woman has these experiences when entering treatment, this process of recovery will be much more difficult if you're not also focusing on these experience of trauma.
And one thing that you mentioned that I thought was really interesting that I was unaware of is that women respond to treatment much better than men do. So they're more receptive to it.
Yes, so that's what the study says, but it does entail that the treatment is gender sensitive and trauma informed. So that's the problem there. It could be something that we could see results of if we also manage to implement these areas. And unfortunately, we still have a lot of lack in the expertise, and when it comes to gender sensitive approaches in all areas of our work, be it prevention, harm reduction, treatment, recovery, and social reintegration. So it's important for us to integrate that so that we can actually see the results of this point that women are more receptible.
So I'm guessing getting to that point maybe is a little easier in developed countries But I'm sure it's probably very, very challenging in some of the places that you work in the world that have, shall we say, a less enlightened view on gender relations.
Definitely, it is very difficult because although we can speak in broad terms about what the needs are in ensuring that women have equal access to treatment and recovery, it does differ from cultural and social context, but also country to country and region from region. In certain areas of the world, there aren't any possibilities for women to enter treatment. We have one member organization in Pakistan who opened the very first treatment facility for women in the whole country, and this was only a few years ago. And we've seen, for instance, in India, where our colleagues work, that there are very limited access to treatment facilities where a woman could bring her child, and there were no possible treatment facilities that were based on children and young people. So children and young people were being put in the same facilities as adults, which it just sort of says itself. It's not a fruitful way to accommodate this. But what is also very empowering in regards to developing countries is that it's not always the lack of, from what I have seen, it's not always the lack of wanting to include a gender or child-centric approach, but it's rather that it hasn't happened yet. You haven't been enlightened of the needs. So in India, for instance, we talked with one of our members and board member, Diana Joseph from Fourth Wave Foundation, who we were discussing treatment facilities for children in this case, and she said that there are none of those in her state of Kerala. So we started a small project where her team interviewed key stakeholders within Kerala to ask, if there were child-centric approaches, if they were integrating the Convention on the Rights of the Child, which India is a signee of. And they said no, but then lo and behold, just a few months later, they opened 3 new facilities to focus on children, to provide services for children's specific needs. So it's sometimes more about encouraging and supporting and showing that it's possible, and then it will happen. And for this, and especially in countries where the social infrastructure within the authorities may not be offering particular services, civil society becomes such an important part of this in showcasing the need, but also providing certain services. I mean, a lot of our members, no matter the country, are providing services that are gender sensitive and child centric, and there are really just supporting the communities in which they work and providing services that sometimes are lacking from the government or the official side of the country. So it's fantastic to see that it is a possible change, but it is, of course, still, we talk about 1 in 8 people having access to treatment, and of course there are a lot of numbers here that we aren't seeing because this is over the global population. So there's still a lot to be done, but civil society are really working hard to push for this.
Absolutely, yes. Much yet remains to be done, and it's cruelly ironic that, on the one hand, women do respond better to treatment than men do, but yet on the other hand, they're the ones that are least likely to receive the help they need when it's available. We had Augusto Neto from Macau recently as a guest, the executive director of Art M, and he was talking about this. He was saying that it's very difficult in Macau for women to seek treatment, and if they do, they have to go to a completely different, city or on the mainland, far from anybody they know, because then they'll be stigmatized for the rest of their life. They won't be able to find a marriage partner. It will bring shame on the family, and that's not the case for a man. So definitely a lot, and I'm sure Macau isn't unique in that aspect.
No, that's very true. I mean, a lot of the stigma surrounding women who use drugs and that is creating these barriers in accessing treatment and recovery is to do with the normative gender roles that are available in our societies at large, and perhaps particularly in certain, cultural settings as well, where it is related to not fulfilling this expected gender and family roles, the role of the caregiver, that, causes social penalization and stigmatization. So it is so important to continue to work with trying to lessen the stigma surrounding women, and to do so, I mean, we need to work on changing the norms that are available for women and girls in all aspects of our societies. And that's a hard job, but I mean, it's imperative
I was going to
that we
say,
do it.
how do we go about doing that? Where do we start?
I mean, I think, as with everything, um, and especially in terms of changing gender roles. And here I just have to add again, not only stigmatization within the realm of drug use, but also gender-based violence. We can see that the people who carry out violence are oftentimes people who have very normative ideas of masculinity and femininity. So in order to tackle these issues of what we expect of women and girls, but also of boys and men, and all genders, we need to start very young and talk about these norms that really, I mean, that are negative to everyone. I mean, we have norms that say that boys should be strong and not show emotions, and should just be active and be the man of the household. And so if you're not able to fulfill this norm, oftentimes that renders you in conducting violence, either to an intimate partner, but towards yourself. I mean, we can see that in Sweden, at least 70% of people who commit suicide are men. And men, have a shorter lifespan than women, and it's a lot to do about, not seeking healthcare services, not, being able to talk about their emotions, maybe rendering them in behaviors such as drug and alcohol use, for instance, but also for girls, that young girls are able to be whoever they want, and are equal members of society, that the caregiver role should be something that is, positive for all genders, and not only for women and girls. And we need to start early. We need to talk about this with our young people. We need to start having these conversations in all aspects, with individuals, with our friends. I mean, we usually say, have the talk. You start with yourself, think about what you say and how it may affect others. You talk to the people around you, your son or your friend, your father, your girlfriend. You talk about these norms that are affecting us and how they're affecting us, and try to change this behavior. And then you stand up for other people who are working towards changing these norms, but also then focusing on young children and how we talk to our young children. For instance, if a young girl, or if a baby girl falls down and you lift her up, you say, "Oh, I hope you're okay." Whereas the boy, you would say, "Get up and continue to run. It's fine." That's going to impact, their whole life, and how they see, the tools that they have to express their emotions, and the norms in which they can work. So, I mean, it's a hard, difficult job to do. But I think if we all put our minds to it and work to do this, it would be, we can see real change. And then in terms of women and drugs and accessing treatment and decreasing the barriers, we have, from WFAD side, we have, together with Dianova International, set up an infographic on the ways forward and how we can tackle these issues as civil society, but also as key stakeholders. It's available online. There's 6 simple steps to do so. That include, of course, the need of gender-sensitive and trauma-informed treatments, addressing violence in a comprehensive way, establishing effective working linkages with other service providers, to provide a comprehensive assistance to women who use drugs, but also greater knowledge of the characteristics of addiction in women, and the protocols and trainings should be including this, but also, as simple as evaluation. When we evaluate and monitor our treatment services, our prevention interventions, anything that we do, we need to have gender disaggregated data to show how these impact women and men differently. We can see, for instance, in prevention measures where we have disaggregated the outcomes by gender, that it's different prevention activities impact girls and boys differently. And so how can we ensure that we include this gender approach within any activity or service that we provide?
A tall order, definitely, but I think achievable. So before we wrap up, could you just talk a little bit about some of the greatest successes of the gender working group in working to change some of these norms, as well as some of the greatest challenges that the group has encountered?
Definitely. It has been a really remarkable road since we initiated the gender working group. We have members in the group from different parts of the world: Nepal, Pakistan, India, Nigeria, Kenya, South Africa, Bosnia Herzegovina, Sweden, and Italy. We are still wanting somebody from the US and Latin America, of course, and whoever would like to be involved are welcome to do so. We started off the work by just sort of conducting what do we want to do and what change do we want to see. And we had noticed, for instance, during the annual CND, the Commission on Narcotic Drugs, that happens every year, there were very little discussions about women. There were very few side events, as they're called, that focused particularly on women. And so this was our first step. So we offered quite a few side events during this time that focused particularly on women who use drugs and the barriers that women face. We talked a lot about double stigmatization and in accessing treatment and recovery facilities. And we could see that after the first year, the second year, there were a lot more side events focusing on women. It was something, it sort of got the ball rolling, so to speak. And one of the most interesting things is that, when we're working on this global arena with civil society from across the globe, we tend to stand within our boxes of, we're for prevention, or we're for harm reduction. Like there were very little connections between the different aspects of drug policy. And we've seen that the issues of women and the rights and the needs of women has brought us more together. We've worked now with organizations that we haven't worked with before. We learned a lot from them, and we were able to put out this infographic on the ways forward and how to eradicate these barriers for women entering treatment and accessing treatment and recovery services. And we've seen that, this is a realm within which we can all come together and try to create actual change. And we were able to speak in the plenary session and address the member states. But also, and one of the most exciting parts was this gender training that we did for all of our members a few months ago in the summer, or in the European Swedish summertime. So in June, we had this gender training where we brought in Billy Batware, who facilitated the training, and we offered different approaches and tools and methods to incorporate gender approaches, not only within, as I said in the very beginning, our own organizational structures, but in our interventions. So we've seen a lot of really positive outcomes so far, and just the fact of being able to connect with people from across the globe and discussing these issues have been just so interesting and strengthening not only of the knowledge that we have, but seeing that there are very many differences in different countries, but we still have a lot of the same similarities. So of course, everything needs to be contextual and cultural and age appropriate. But we can still talk about certain aspects on a general term to at least push for stakeholders, governments to include these aspects within the work that they do. But it has been a challenge, of course. Not everyone are as keen to talk about these issues, although much less much less opposition than I thought. I mean, we haven't experienced any negative feedback. All of our members, for instance, have been very happy about this strategic goal and the trainings and everything. But there is, of course, always it was more about the lack of knowledge that women are also impacted by illicit drug use. I mean, some of our colleagues had never even thought that women are affected by drugs, and never thought about the double stigmatization. So, sharing the knowledge, which is the first step, was that was the first step. But I mean, perhaps I'm being too positive now, but I can't think of any large challenge, really. More so than lack of data. Historically, we haven't researched enough on women and drugs. We haven't done enough gender disaggregated evaluations of our programs at large. So there are still quite a lot of knowledge gaps, which we now hope to in the future fill in by applying for research projects or research funding, where we can focus more on these knowledge gaps and try to fill them, so to speak.
So do you think, for example, sometimes when there's, say, a side event at C&D on a particular topic, that there can be a kind of unconscious bias that the content is for men and about men, and so women don't, the consideration of women doesn't even enter into it. And I wondered, to what degree do women also participate in that?
I mean, definitely, I would definitely say that. I think that's one of the main problems about about gender mainstreaming. When we started to talk about women's rights in general in the UN body, but also in certain countries, gender mainstreaming is just, when we're not focusing on highlighting these issues in particular, we're working from a gender neutral idea, but the gender neutrality in reality is actually just focusing on men. So a lot of the time when side events are not mentioning gender differences at all, it's because that data or those issues are based on men, and that's a problem with not only side events and how we talk about it, but also in for instance, like I said, in prevention activities. They've seen the little evaluation that we have. We've seen that girls in certain programs that are targeting schools, for instance, boys are greatly affected in a positive ways, but it has little to no impact on girls. Whereas for girls, working with prevention in the family and in the home has a greater outcome. But then we're creating these these programs and these ideas and activities without having an idea of gender differences, then it becomes based on a male norm. And, a lot of the times, and for a lot of boys and men, they're not within that norm either. So we're creating these activities that we don't know if they actually have any positive outcome. And yes, of course, women are also part of this. I mean, this is a big problem at large. I mean, we're all living in a structure of patriarchy where we're all used to this, and it needs to not saying that it's necessarily bad, or it's necessarily bad to, I mean, maybe now I'm thinking how to say this, but it's it's important to focus on gender sensitive approaches, and with what I mean by gender, including all genders, men, women, other genders as well, because when we're trying to remain neutral, the positive aspects of that will only affect a very small group of men, but also a very small group within men, usually white men or Western men, or even within the realm of gender, we need to push the boundaries a bit of who we include, and we need to ensure that programs are individual and culturally sensitive, age appropriate, and also the need to expand the concept of gender to include everyone, not only within the heterosexual norm of the childbearing age, where when we speak about women, usually in terms of research and women who use drugs, that's the group that we're looking at. But we need to include all women and men and other genders of all ages and backgrounds and abilities, and integrating, enlarged concepts such as consumption patterns and barriers in accessing treatment and recovery for the LGBTQ plus community as well. And we need to train professionals in gender informed approaches that that do not uphold these normative ideas of what a man should be or what a woman should be, or how, you know, these differences would work. So a very long answer, and I'm not sure if I provide or if I answered your question. Please let me know. Otherwise, I will try to circle back.
Well, you did. Thank you very much. And you raise a really good point that these preconceived notions of, you know, what is masculine and what is feminine, they can be and they are incredibly damaging to men. Um, so we definitely have a lot of work to do towards becoming, you know, more inclusive. Um, but I thank you so much for coming on and agreeing to talk with us. I hope that one day we'll get to the point where, you know, men and women can work together equally to create a world of beauty and harmony. But until then, you know, we'll keep having to do the best we can one day at a time. Um, so thank you so much, Regina. I know our viewers are gonna love learning about the work that WFAD does. So look
Thank you
forward
so
to collaborating in
much.
the future.
As do I, and thank you so much for having me. And just as a final conclusion, you know, the ways forward, I do encourage everyone to, you know, go onto our website, become members if you'd like, but also to see the work of the Gender Working Group. We have two key documents there that I offer, you know, a way forward in eradicating the barriers for women, but also in creating these more inclusive environments for treatment, no matter the gender. So I hope the same as you, that we can move towards a world that is more inclusive of everyone and where the barriers are much lessened. I mean, there's a lot of work to be done in, you know, accessing treatment and recovery. No matter who you are, we still need to strengthen these approaches to ensure that, you know, the healthy and safe development of our peers and our communities and our children and families as well. But I thank you so much for having me. It was a true pleasure to talk with you and to be here with you in this podcast.
Thanks again, Regina. And thanks again to all of our listeners without whom this podcast would not be possible. And I'd also like to thank the Adelson Family Foundation for their generous support of this podcast. To learn more about the great work the World Federation Against Drugs is doing, you can visit their website at wfad.se. You can also visit Drug Free America Foundation's website to find out the latest on emerging drug trends and research. Our website is www.dfaf.org. Thanks again, and we'll see you next time.